10 kidney killer foods you must avoid. One of the kidney's most important jobs is to filter impurities out of the body and to maintain our general health. Did you know that what we eat can have a significant impact on the health of our kidneys? While some nutrients may be harmful, others may be beneficial. In this video, 10 popular foods that may be detrimental to kidney health will be examined. We will also examine how specific pattern decisions may affect the physiological stress that the kidneys endure. Chronic kidney disease, or C.K.D, is a progressive loss of renal function, toxin removal, blood and urine filtration, and physiological process modulation all depend on kidney function. Renal failure can therefore be lethal if proper therapy is not received. According to the 2016 US R&D's report, 14.8% of adult Americans are estimated to have C.K.D, with that 3% of individuals over 40 having the illness. Over 7 million of Americans suffer from C.K.D, and more than 80% of them are not aware that they have the illness. It can be difficult to diagnose chronic kidney disease, C.K.D, in its early stages because the illness often shows written signs or symptoms. Individuals 60 years of age or older who have diabetes and hypertension are in increased risk of kidney disease. To determine whether you have the condition, please consult your doctor for testing. The following signs could point to kidney problems. 1. Increased exhaustion, decreased energy, or trouble focusing, which could be caused by an accumulation of impurities in the blood because of kidney disease. 2. Renal filter injury might lead to an increased urination frequency, especially at night, or form a urine indicating excess protein. 3. You may experience swelling in your feet and legs due to kidney dysfunction, leading to salt retention. 4. Electrolyte abnormalities, which are associated with kidney-related disorders, such as calcium and phosphorus deficiency, are the causes of cramping in the muscles. It is vital to identify these signs and take precautions to avoid renal failure. A careful diet is one of the most important things you can do to prevent renal failure. Let's discuss 10 foods that can negatively affect your kidneys. 1. Avocado. People who already have kidney disease should be extra careful when eating avocado or other high potassium food. An average-sized avocado has about 950 milligrams of potassium, which is 47.5% of the 2,000 milligram daily suggested amount. It is best to eat only a quarter of an avocado at a time. 2. Banana. Along with fiber, bananas have a lot of potassium, vitamin B6, vitamin C, antioxidants, phytonutrients, and other important nutrients. The potassium level of one medium-sized banana is relatively high, at 42 milligrams. Thus, it should be taken with caution. Pineapples may be a better choice because they contain less potassium. 3. Sweet potatoes and potatoes. Potassium is abundant in potatoes, especially with potatoes, and 610 pound potato. There is an astonishingly high potassium content. You can reduce the potassium content of potatoes by up to 20% by soaking them in water or freezing them for 5 to 10 minutes. However, to be safe, control the intake level. 4. Tomatoes. Tomato sauce has a potassium content of 78 milligrams packed up, 245 grams. As such, consideration of substitutes with a reduced potassium level is essential. For example, roasted red pepper sauce tastes just as good but contains less potassium per serving. 5. Spinach. Spinach contains a higher amount of oxalate than the other vegetables. Eating it in moderation can help reduce the risk of kidney stones. 6. Dairy products. Dairy products naturally include potassium and phosphorus, due to the 2 milligrams of potassium and 205 milligrams of phosphorus that are found in 1 cup of whole meat. The medical term of hyperphosphatemia refers to a buildup of phosphorus in the brandicin brought on by a renal damage. Therefore, those following a renal diet need to restrict the embedded consumption in order to prevent this. Because coconut milk contains relatively low levels of potassium, salt, and oxalate, it could be a good option for people suffering from kidney disease. 7. Soda. Soda contains harmful stuff like phosphoric acid, high fructose corn syrup processed and bleached sugar, and a ton of caffeine. Kidney stones can arise as a result of the metabolism of high fructose corn syrup, which turns it into oxalate and helps excrete calcium and uric acid. Because phosphoric acid creates an acidic environment in the limb of trout, it further encourages the formation of kidney stones. Plus, a bunch of fizzy drink have rules of caffeine, which is an diuretic that can cause long-term dehydration and is the main reason for kidney stone formation. 8. Alcohol. Alcohol can cause oxidative stress and inflammation within the kidneys, which might potentially compromise the kidney's complex filtration system. According to the National Kidney Foundation, the risk of having hypertension rises with each additional alcoholic beverage ingested each day. It is critical to highlight the high incidence of hypertension as a risk factor for chronic kidney disease. 9. Processed meats. Processed meats have undergone procedures like curing, smoking, fermenting, or salting to improve their flavor and texture and extend their shelf life. This leads to extremely high sodium content, and they should not be consumed, as it may cause hypertension and renal discomfort. Processed meats include sausage, hot dogs, bacon, pepperoni, pastrami, and corned beef. 10. Dried fruits. Due to their high potassium or sugar content, dried fruits, more specifically raisins and dates, are not recommended for people with diabetes or kidney disease. Eating these fruits can increase the risk of blood glucose elevation and worsen renal failure. Even though kidney problems are extremely serious, they usually get better with therapy, particularly if they aren't discovered early on. See a medical expert as soon as possible. If you found this video beneficial, please consider subscribing to our channel in order to receive more health information. Remember that your kidneys deserve the best treatment possible for a healthier future. So let's go forward with informed choices.